symptoms, it will cover the causes, it will cover the remedies by asanas, breathing practices, and diet follow. So if any of them have specific questions, they can let me know before in hand, so I can cover up that portion also in the session. Regarding diabetes.
Abhijit, any specific thing that you want to address, you can tell it right now. So during the session, Nana ma'am will cover that particular point as well for the diabetic part.
On a lighter note, I would like to know how to keep the mood on, because the diabetes, the moods, there are some mood swings. So
Okay.
need to know if you have some remedy for that.
Right. This is a very, very nice question we can think of. Yes.
And I think it must be on everybody's mind.
Absolutely. Be it a diabetic or non-diabetic, this question is very at high level.
Absolutely.
Usually when I speak to my wife before going home, if she's not in the mood, I just pluck up a rose from a shop and then go home.
Wow, this is good one. Good to start with.
Yes. Okay. So we will start 11:05, right, Anamika?
Yeah, we can start.
Okay, perfect. Good morning, everyone. We are back over here with one other session in this new year, we can tell after Diwali, which is the session number 16. And the session is all about awareness of the diabetes, how that can be taken care, the remedies, the causes, everything in this today's session we are going to learn from Nana ma'am. So please do focus and hold your seats tight. So we'll start the session. Over to you, Nana ma'am.
Thank you, Jayesh. Good morning, everyone. And hope so that everyone's Diwali has gone very good and very best, and welcome all in a very good new year. Maybe this year should be a healthier year for everyone. So tomorrow is the World Diabetes Day. So I have made an attempt to take today the World Diabetes Day special event, including everything about diabetes. So I'll include all the symptoms, the causes of the diabetes, and what the precautions you should make if you are a diabetic person or a pre-diabetic person, or what else we can do to minimize or control the diabetic level with the help of diet. We have 4 rules in yoga, that is ahar, achar, vichar. वो चारों rules हमने follow करके क्या कर सकते हैं, that will be all included in the session today. So I'll just start the session with all the detailing, including the asanas and the pranayams, and the quick, small, easy diet tips which can be followed at a regular basis to get in all the benefits of it. So in the end, I'll just give 5 to 10 minutes for any of the queries or questions you have. So please be open to all the questions or queries, whatever you have, and do take care that you just pay attention, whatever the movement. So I will just make an attempt to make all the asanas very easy on a basic note, so it can be done with for everyone. Now, as we are sitting on the chair, so I'll do all the asanas sitting on the chair, and I'll also mention how you can do it when you're on the mat itself. So it will be an easy one to remember also. And I want a promise from all of you that it shouldn't be a day, because we can't cure this diabetes in a day, in an hour. But we can make an initiative to walk forward to a healthier life, rather than just to think that now it is a diabetic, so I can't do anything, or the family member which is having a diabetes, it can't do anything, just you have to pop out the diabetes pills and you have to walk in for the side effects of the diabetes. No, it is not so. Just clear the myth that you will be beneficial by your work done by on yourself. By work, I mean the asanas and the pranayam, what you will follow for yourself. Okay. So I'll start off with the session. So diabetes. So what is diabetes? If everyone knows, India is called as the capital of the diabetic people. So how this had happened? Because our food, the traditional food, is very healthier. If we follow any of our traditions, maybe any of the castes, but the tradition what we follow is completely good. We have a complete good tradition food, what we have in our Indian culture. So it includes everything. But what happens now is that due to our daily hectic life schedule, we have just forgotten our traditional food. We have just forgotten the way we have to live in a happy, healthy manner. We are completely stressed out. Everyone, we are stressed out so much that we are just forgetting everything, that how to even smile in a daily life. We are just bothered about the things what we have to do. We are stressed out that आज मुझे ये काम करना है, आज मुझे ये यहाँ पे जाना है, आज मुझे ये करना है, but we are not taking a break, just a few seconds break to even take a deep breath. So this can be the lifestyle problem, can be one symptom, one cause of diabetes. Diabetes are of 3 types normally. It is 4 types. It is diabetes 1, diabetes 2, the pre-diabetes, and the gestational diabetes. So diabetes 1 is the complete autoimmune problem. In that, what happens? Your internal immune system destroys your insulin power completely. So the reason for that is not exactly proven that what is the reason of that, but it is an autoimmune system, and this can be controlled till a limit, not at a great limit. But yes, definitely, if you follow the asanas and pranayams, it can be controlled to a limit. Diabetes 2, that is found commonly in Indians. That is because, or maybe it is a genetical problem or a complete lifestyle problem, a lifestyle disorder, which turns into a diabetic problem. So what is this type 2 diabetes? In which insulin resistance is seen. Like whatever you are taking in, that is not completely absorbed. Your cells are resistant to the insulin power which your body is releasing. And after a point, what happens? That the nutrients, what you're having, whatever you are having, the nutrients are not passed on to the cells all over your body, and that results in the starving of the cells, and that results in the weakness of your cells completely, in the weakness physically and mentally, and that results in the complete failure of the insulin power. So the insulin, what the body is releasing, it cannot reach to the cells to digest all the food what you're having and to pass on the nutrients to the other thing. This is seen in diabetes 2 things, and this diabetes 2 can be definitely controlled, can be definitely be useful for you if you follow the complete lifestyle routine check and pranayam and meditation and with the proper asanas. So I'm not telling you that you have to just give 2 hours to it or something. I know everyone has a tight schedule, so I think so you can remove half an hour for yourself to cure yourself completely. I have a patient who came to me when she was taking insulin injections thrice a day. So their diabetes level was completely high. She was a lady of 45 years of age when she came to me. So she was taking insulin thrice a day, the morning, afternoon, and evening with the medicines. And she was an heart patient also, a BP patient also. And normally it is seen that when you're diabetic, your cholesterol levels are high. So she has everything problem. And I just gave her simple solutions. By simple solutions, but she did it consistently without the break. Till today, she is doing it. So she has cut down her insulin injections just within, I think so, within 3 months or so. It has cut down to 2 injections. It has cut down to 1 injection, and now only on tablets. So definitely it has reduced with all the issues. So it is a myth that कुछ नहीं हो सकता है. अभी डायबिटिक हो गया है तो अभी हमको तो लेना ही लेना है. इंसुलिन है तो एक बार इंसुलिन लग गया तो बस अभी वो बंद नहीं हो सकता है. So first, remove that myth from out of your mind. You are doing everything to cure yourself. There is a solution for every problem. So just keep in mind and just accept that you are being diabetic. Just accept that, yes, I have to go forward with this diabetes, but definitely I will control it. Okay. So what are the symptoms that I've seen? That as Sir has mentioned, mood swings are there. Less energy is there. Less of energy is there. The muscle doesn't acquire that much strength, that much proteins, and the lean muscles is lost due to diabetes. So the tiredness is seen, the bulginess of the stomach is seen because indigestion issues are there seen in diabetic people. The pain in the leg is often there because normally anyone who is diabetic, they have to take care of their legs because lots of nerve pain is there, lots of diabetes pain is there. Insomnia is seen in diabetic people. Loss of memory is seen, loss of vision is seen, and many of the skin problems are also seen, the dryness of the skins, the itchiness of the skin. So it can be any of the things. The symptoms varies from person to person. Fungal infections are seen very much. In males, the loss of libido is seen. In females, vaginal infections are seen. So there are a lot of symptoms what you can mark over if you are a diabetic person. If any of the symptoms you are taking care, and even the increase of weight or sudden loss of weight is also included in diabetic symptoms. So if you have any of the symptoms, do take an attempt to just check it out. What are your diabetic level, or what is the daily checkup routine of yourself? Okay. So the third one is the pre-diabetic thing. What is a pre-diabetic portion? In which what happens when you check the diabetes, it will be normal. But if you take it at an average, the HbA1c level, that will be increased. So that is a pre-diabetic portion. So whatever is a pre-diabetic portion, like when you check the HbA1c, that is the average counting, maybe of 3 months average counting. In that, if the level goes above 6, then you are on a pre-diabetic age. It can be happen that you may be diabetic soon. So you have to take precaution for that. Okay, so this can be taken care of very easily and very nicely with just following simple tips. Okay, and the fourth one is the gestational diabetes. What is the gestational diabetes? It is seen in pregnant ladies due to overweight, due to hormonal changes. Some of the ladies get gestational diabetes during the pregnancy period, and that is continued even after the pregnancy, and that is harmful for the baby also and for the mother also. So how to prevent all this, how to take care of yourself, we'll soon take care of the asanas and the breathing patterns completely. Okay, now in this, it's very important to have a healthy mindset, to have a positive mindset. And we'll begin the session with a positive mindset, with a positive attitude, with a gratitude that yes, I will cure myself. I will cure the insulin power inside me. I have the power to heal myself completely. And definitely it will result positively. Okay, so everyone will start with a positive attitude. Now for the check on the asanas, simple asanas we will do to improve our digestive system completely and to improve the insulin power which is released by the pancreas. So the pancreas have the positions exactly below the stomach. So it is somewhere over here above the navel portion. Okay, so we'll take care of this, which releases insulin power. So what happens in some cases, the pancreas, they don't the pancreas don't work nicely and can't release the insulin, or the pancreas is releasing the insulin, but the resistance is created and it is not reached to the cells of the body. So it is seen that if you are a diabetic person, slowly and steadily, if you don't control the diabetes, it hampers all the organs of your body from toe to head. So this is a serious condition if you have not taken care of it. So simple twisting, bending, taking care of your diet, taking care of your sleep, of your total lifestyle check will definitely help you to balance your diabetic level and to balance each and every problem of yourself. Okay. Now we'll start with a simple stretch. Surya Namaskar is said to be completely beneficial for diabetic person. In Surya Namaskar, what happens? You are stretching out all the organs completely from head to toe. So this helps to improve blood circulation and all over your body. So again, you should do this with a proper guidance when you're doing it, because this session includes, I am telling it on a very basic note. So as I mentioned, if you have only diabetes, that's fine. But if you have with it hernia issues are there, or any of the heart issues are there, or heart BP issues are there, then please take the good advice, contact me or any of the concerned person, and please do it under a proper guidance, because yoga, pranayam, meditation has limitation when it goes to a medical condition. So doing it with a modification will definitely help you all. So now we'll stretch with the complete. You're stretching it from the navel and from your neck. So just raise up your hands completely. Take a namaste of your hands. Pull up your spine completely. Stretch it out completely. Stretch. Now take the chair support and stretch it back completely. Pull your system up from your navel, from your neck. Take the pull completely. Stretch it out. Inhale. Now exhale. Lengthen it up completely. Squeeze your navel in and go down. Go down completely. Again, lift up. Take the hands up again. Stretch up. Inhale. Stretch, 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 stretch. Exhale. Squeeze your navel in. Lengthen your spine. Squeeze your navel in. Complete exhale and go down. Very good. Same thing you can do it when you're standing. So stretch it up completely. Stretch. Navel or gale se pull. Inhale. Exhale, squeeze your stomach in, lengthen your spine, tilt your pelvic inside and go down. Take your head down. Very good. One more time. Stretch up. Inhale. Exhale. Squeeze the navel in and go down. Slowly come up. Breathe. This simple bending will help to cool down your mind also. When you're taking your head down, you're relaxing yourself. You are initiating blood circulation towards your head, towards your stomach area to improve the blood circulation over there. It's very necessary so that the working of the pancreas, working of the stomach, working of the digestive system, working of the blood circulation all over your body is very effective to control the diabetes level, to control any of the problems in your body and your mind. And when you go down, you're reducing your stress level also. Stress makes a major role in increase or in spike of diabetic level in your body. So you need to balance your stress completely. And even stress leads to mood swings. So if you have seen any of the person in mood swings, that is completely related with the stress level. Stress, it doesn't mean that it should be a very big thing. It can be smaller things also. So do care, take care of smaller things and the bigger things both. ऐसा नहीं कि खाली बड़ी चीजों पे ध्यान दो, छोटी चीजों पे नहीं. Simple things also makes a stress level. One more point I have to clear, that if you can check any of the person who is diabetic, that person is very particular about his work. तो वो उनमें वो रहता है कि they are very particular. Like if I have kept the chair in the straight position, and I have tilted it. The person who is a diabetic person, that person is a very particular one. They want the chair only in 90-degree position. 90 का 89 भी नहीं चलता है और 90 का 91 भी नहीं चलता है. तो उतना उनमें वो perfection रहता है. That perfection leads to a stress level further. So that has been seen. One of the symptoms of the diabetic person, that they are a very perfect one, and they are the perfect one, and they want that the former one also should be perfect as they are. But if I can say any of the diabetic person who has this nature, they have to change their nature a little bit. You do it as you are doing, but don't think that the other one will follow it too. That will really help you to reduce your stress level completely. Okay, so this was the first one, to do the bending forward and to reduce your stress level and to improve the blood circulation in this area. Okay, now we will go for the twisting. Twisting is very important in diabetes things because you are giving a twist to your spine, you're giving a twist to your stomach area, and the twisting helps to initiate blood circulation and helps to initiate that working of the pancreas and the digestive system. So simple twisting is legs together, hold on to the chair back, hold it and look back completely. Take the twist. And include breathing with it. The body-mind coordination helps to make this thing easier and more profitable for physical and mental things. Okay. So other things, inhale forward, Exhale, twist back completely. Very good. Inhale, exhale, twist back completely. Inhale, exhale, twist back. Very good. Inhale, exhale, twist back. Release. Inhale, exhale, twist back. Release it, relax. This was when you're sitting on the chair. Same thing we can do it when you're standing. Okay. When you're on the mat or you're standing, just raise your hands straight, legs apart. This will be inhale. Twisting out completely will be exhale. You're twisting it out completely, your toes are straight. Straight again. Inhale. Exhale. Very good. Stretch. Inhale. Exhale. Inhale. Exhale. And release it. Now in the same standing position, we'll take Trikonasana. For this, you have to just move your right toe towards the right side. Left toe will be towards me. Your hands straight. And you take the right hand towards the right toe. Inhale. Exhale and go down. Look up towards the ceiling. Stretch completely. Normal breathe. Releasing will be exhale. Now we'll do the Viparit version, the opposite version of this. That is the Viparit Trikonasana. This is 1, 2. Now you're taking your left hand towards your right toe. If you're not reaching your right toe, that's fine. You can hold on to the knee also. Just you have to twist your stomach and your spine completely. So inhale, exhale and twist. This twist will help to initiate the insulin power, to improve your insulin power in the body, and also it reduces the stress. It improves your blood circulation all over your abdominal organs. Slowly release it, relax. Same thing we'll do to the other side. So again, turn the left toe towards the left side, your right toe towards me. Stretch your hands up. Go towards left hand towards the left toe. Inhale. Exhale and go down. Look up towards the ceiling. Stretch. And slowly release it, relax. Opposite. 1, 2. Breathe in. Breathe out. And stretch. Look up towards the ceiling. And slowly come up. Release it, relax. Toes forward. We have done this one time. Same thing, you can do it at least 3 times right side, 3 times left side. So this twisting will definitely help you to improve the blood circulation towards your all abdominal organs. And now when you're doing it on the chair, you can do it the Parsha Konasana on the chair with the help. You can bend your right knee, extend your left toe forward, and we'll do the Viparit one on this. So just take your hands straight. This will be 1, 2. Now you're taking your left hand at the side of your outer side of your knee. So you're twisting it out. This is 1, 2. Breathe in, breathe out, and twist. Take the hand up and just hold it over there. You're twisting the system completely. Okay. We'll do it again. This is 1, 2. In 2, inhale. Exhale and twist. Take your hand outside the knee and just stretch it out completely. Right. This can be done as we're doing it on the chair. It can be done by a senior citizen also who was not able to stand or who was not able to sit down on the floor. So that will definitely help. Now to the other side. Bend your left knee. Straighten up your right toe. Hand straight. 1, 2. Breathe in. Now take your right hand outside the knee, exhale and stretch. And release it, relax. Again, 1, 2, breathe in, breathe out and stretch. And release it, relax. Very good, release it. Take your legs together and release it. As I mentioned, a diabetic person faces problem of leg pain very much. So it's very necessary to release your toes, your ankles, your calf completely. So the simple, you can do it toes up and down sitting on the chair, or you can stand up. And with the help of the chair, you can just raise your toes up, heels up completely. When you're raising it up, take the pull completely towards your hip line. Go down and take the toes up. So this is inhale,
Ma'am, can you turn the camera a little bit upside?
Okay. Lift up, stretch.
Yeah, perfect.
Thank you. Exhale. Lift up. Inhale. Exhale. Very good. Inhale. Exhale. Lift up, hold it, and just take the pulses. Go 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Release it. Relax. So here you have released your legs completely. You have improved the blood circulation all over your legs. Just take a walk. Relax. Now we will improve our spine health. Spine health is very important to improve the digestive power, because spine is completely connected to the digestive system. If you have any of the spine problems, you could face difficulties in your digestive system also. And in yoga, there are 3 bandh, as we have done it earlier also. So 3 bandh hai. Mooladhara bandh, that is at the groin muscles. Udyan bandh, which is at the abdominal area, and the Jalandhar bandh, which is at the thyroid glands. So ये तीनों बंद हम लगाएंगे spine को extend करके, which will help to improve the blood circulation and all over the nerves in our body. Okay. So how to do it? Just stand with the help of the chair. We'll do it. Legs apart. Lengthen your hands upwards. Inhale. Stretch out completely. Exhale. Adjust it as per your height and stretch it down completely. So you have to tilt your pelvic inside. Thighs rounded inside, groin muscles squeeze in, navel in, chin to the collarbone. Hold it over there. तीनों बंद लगा के normal breathe रखना है. And release it. Relax. Very good. So this was the stretch of all the 3 बंद. हम ये तीनों बंद बैठ के भी लगाते हैं प्राणायाम में. हम ये आसन में भी लगाते हैं. If everyone has heard the downward dog position, the Parvatasana, which is a completely beneficial one to reduce our stress level also. So वो करना कैसे है? तो chair को आप नीचे यहाँ पे पकड़ना. With the help of the chair, I'll first show you. Stretch up. Inhale. Exhale and go down. Stretch completely. So releasing. You are inclined your position. Just rest over there. Squeeze your navel in. Squeeze your groin muscles together. Chin to the collarbone. You will find the blood circulation rushing towards your head. That will completely relax yourself completely. Slowly come up. So ये पूरा अगर आप floor पे करते हो तो completely it will go straight down on the floor. So it will go completely on the floor. You have to hold it over there and then press yourself down and maintain it over there. Slowly come back. So what we have done now, these all in Surya Namaskar. So whatever Surya Namaskar, even Bhujangasana, Dhanurasana, Salavasana, this all asanas which includes the abdominal organs that helps in maintaining the diabetic health. So that we can do on the mat when we are on the mat. Now Surya Namaskar we'll do when we are on the chair. Okay, simple methods of Surya Namaskar when we are on the chair. So take everyone legs together, hands near your chest. Take a normal breathe. Inhale. Exhale completely. Now stretch your hands up, stretch up completely. Inhale. Navel or gale se pull. Exhale, lengthen your spine. Slowly go down. Inhale. Take your left leg up. Hold it. Push it towards your chest. Stretch your neck up. Exhale. Take it down. Release. Stretch up. Inhale. Exhale. Again go down. Inhale. Take the other leg up. Stretch. Exhale. Take it down. Stretch up. Inhale. Exhale. This was a seated Surya Namaskar. It can be done 4 times. It can be done 6 times or a complete 12 rounds session. So it depends. On this also you can do it on the floor also, and you can do it on the chair also. I'll just show you once the Surya Namaskar proper method on the floor. So you can just check me out and you can follow this when you are on the mat. So definitely, I will be happy to do everyone on the mat too. But for now, you can see me how it is done in a right manner. Today I'm doing it with shoes, but you shouldn't wear shoes for that. Okay. Inhale, stretch up. Exhale, squeeze your stomach in and down. Inhale, take the left leg back, stretch. Exhale, downward dog position. Hold your breathe and plank. Tuck your knees down, toes out, chest and chin down. Breathe and roll your shoulders back. You are having a pull from the neck, pull from the navel. Exhale, downward dog position. Inhale, leg forward in between your hand. Exhale, both the legs together. Hatha ka namaste, stretch up from the navel. Inhale. Exhale, release it. Okay, this is the right method, including breathing with each posture, including your mind-body coordination for each posture. When you connect your mind towards your body and you breathe with it, it definitely helps you completely to maintain a happy, healthy life, physically and mentally. So, जो फर्क आपको योगा में ये तरीके से करके दिखता है, that I can guarantee within a week, or you can say even within a 1 hour session, you could find at the end of the session, you feel more fresh, you will feel more energetic, and your happy hormones are released, and you feel happier and lighter at the moment. Okay, so due to time restriction, I cannot increase the Surya Namaskar now because I want to include everything in it. So definitely, if you have any of the queries further, you can contact me and you can get a guidance over there. Okay. Now we'll move forward for Mandukasana. Mandukasana plays a major role in improving the insulin power. मंडूकासन जो नीचे बैठ सकते हैं वो वज्रासन में बैठ के कर सकते हैं, जो नीचे नहीं बैठ सकते वो चेयर पे बैठ के कर सकते हैं. जैसे आप यहाँ पे हो एज अ कॉर्पोरेट एम्प्लॉय, यू कैन ऑलवेज बी सीटेड ऑन द चेयर एंड यू कैन डू इट. So it is very useful, but this is done empty stomach only, as it is including to improve the digestive power and it is including to improve the insulin power. तो इसके 3 वेरिएशन हम करेंगे, हर एक वेरिएशन हम 2 टाइम्स करेंगे. ठीक है. सो मुट्ठी बंद करेंगे, हम अंदर लेके close your mutti. Okay. Now first is to improve the digestion power. So this is below the navel. Below the navel, keep it. Okay. A little distance in your legs, not much, a little distance. Now when you will go down, the knuckles will come together. So this is inhale. Exhale and bend forward. Relax your shoulders. Feel the pulses below your navel. You're improving your digestive system. You're releasing all the toxins. You're improving clearing your large and small intestine. Slowly come up. Release it, relax. Very good. One more time, repeat the same thing. Inhale. Exhale and go down. Relax. As I said, anything bending down will relax your mind also. So this definitely relaxes your mind also. Slowly come up. When you're doing it in Vajrasana position on the floor, when you go down, you don't have to lift the hips from back. You have to go down with the hips and heels together. After keeping the hips and heels together, try to reach the forehead to the mat. Okay. Now the second one is keep the thumb, keep your fist above your navel, exactly above the navel where the pancreas are. So inhale. Exhale, take the knuckles together and press down. Hold it over there, relax your shoulders, relax yourself, normal breathe. Improve the insulin power completely and slowly come up. With every movement, keep the mindset that it is you are improving more, you are becoming more and more healthier and the insulin power is improving. Again, inhale. Exhale and go down. slowly come up. Release it, relax. Now the third one is open up your hands. Just keep it on the navel. The other hand above the navel. Inhale. Exhale and go down. Slowly come up. One more time. Take a deep breath. Inhale. Exhale and go down. And slowly come up. Release it. This simple movement helps to improve the insulin power. It helps to improve your digestive system completely. So this will definitely help to control your insulin power, to control your sugar levels in your body, and that will definitely help to reduce the side effects of it. Yoga and pranayam not only helps to maintain the sugar levels, but also it helps to maintain your mindset. What happens whenever you see sugar, or whoever is diabetic or a normal person also, they get sugar cravings very much. So how to control that? It is very difficult to control the sugar level, sugar cravings. So if you are a yogic person, your mindset becomes so strong that even if you have sweets in front of you, you will definitely not have it. So this improves the mindset because you know what is good for yourself, and that automatically comes from inside, that you have that from inside that yes, I don't have to eat this, or you have to eat a very little portion of this. And we are coming to the diet. I may suggest some things on the diet. As Diwali has just passed on, and I think so many of us बहुत कुछ फराल बनाया है और बहुत कुछ खाया है. कुछ ने तो इसलिए भी खाया है कि भाई पड़ा है, खराब हो जाएगा तब खा लो. तो this is the attitude generally of Indian people कि कुछ भी पड़ा है तो भाई इसको खा लो, खत्म कर दो. But I think so it shouldn't be that, because what you are having it, you're dumping it inside. So why not dump it in the dustbin itself? So don't dump it inside yourself just to finish it off. Think what you're having. Is it fruitful for yourself? Is it fruitful for your body and your mind? Will it make you healthier? मैं ऐसे नहीं बोलती हूँ कि for everything you have to think over there. No, you can have junk foods, but you should be conscious eating. You should have that in mind, that you should have a conscious eating. I'm not saying that completely say no to sugar, because अगर मैं वो बोलूँ तो एक आध जन follow करेगा, हर कोई ये follow नहीं करेगा. For diabetic person, all the white things are a complete no. It will be maida, it will be bread, anything made out of maida. It can be sugar, it will be sugary things. Milk, many of them are not comfortable to milk also. But definitely curd and chas, buttermilk is very good for diabetic persons. So please make a check that बहुत सारा sweet नहीं ले आप. आपको अगर sugar cravings हो रहे हैं, to take a small portion of anything, but just a small portion. It will be just a small portion, and you should be completely satisfied. कि हाँ भाई, होता क्या है जब आप छोटा खाओ या बड़ा खाओ, बाद में तो वो कुछ रहता नहीं है, वो खाली टेस्ट का है मैम. So if you are satisfied with a small portion, then the sugar cravings will definitely go up. So keep in mind that you have to be healthier. So you have to eat a healthier version for yourself. For a diabetic person, methi ke dane works magical. In the oven, soak it overnight. Methi ke dane, a little teaspoon, and just soak it overnight. And after in the morning, in the first attempt, you have to drink that water and chew that methi seeds. If chewing is not possible, then gulp it down with a glass of water. So that will definitely help to control your sugar levels. It will help to improve the digestion power. And please, but I do say, अगर आप सुबह मेथी का पानी ले रहे हो, मेथी ले रहे हो, और बाद में आप मिठाई खा रहे हो, तो ये काम नहीं करेगा. So it should be a complete lifestyle check. Okay? So मेथी के दानों से आपने चालू किया है, फिर वो होगा a proper portion. Portion control is very much necessary in a diabetic person. Diabetic person जो है, it shouldn't go on complete fasting, because that is not at all good, and it also not do any time overeating. Overeating जब भी हुआ, you're overeating your system to digest that, and what will happen? That will not digest it and it throw away to increase, you spike up your sugar levels. So don't take that. Take small portions and have healthy food in between the snacks. Okay? जरूरी नहीं है कि आपको 6 मील लेनी है. depends on the tendency of your body. How your body demands, just listen to your body. Okay. So start the day with methi pani. Limbu pani is also good for you. गरम पानी लींबू में साथ, जरूरी नहीं है कि शहद डालना है उसमें, शहद में बहुत सारी शुगर रहती है, so diabetic person should avoid that शहद. Okay, तो ऐसा नहीं है कि हमने शक्कर बंद कर दी तो jaggery is a good form, so we are including jaggery. No, jaggery is also a form of sugar. So whatever control you are making, and one more thing I have to clear कि ऐसा मैंने देखा हुआ है कि जिसको डायबिटीज रहता है वो शुगर नहीं लेते हैं, जैगरी नहीं लेते हैं, पर हाँ भाई मैं शुगर फ्री खाता हूँ, मैं स्टीविया खाता हूँ, वो तो शुगर फ्री है, स्टीविया है. नो, दैट इज ऑल्सो नॉट गुड फॉर योर हेल्थ. ओके, तो जितना भी पोर्शन रहता है, इट इज देयर, इट इज अ प्रोसेस्ड वन. सो एनी ऑफ द प्रोसेस्ड थिंग्स आर नॉट गुड फॉर योर बॉडी एंड योर माइंड. सो प्लीज अवॉइड. आप उससे बजाय हल्का सा शक्कर लेके आपने खाया, and please note my word, I'm saying no sugar. अगर नहीं जमता है तो थोड़ा सा natural sugar, नहीं जैसे आप डाल के बस have it done. And it's all depends on our taste to create the taste in ourselves. So easily आप without sugar का खा सकते हो. So avoid stevia, avoid sugar free that has its own bad side effects. So please avoid it. तो उसमें क्या हो जाता है, आप गाजर का हलवा बना लिया, गाजर के हलवा में बहुत सारा स्टीविया डाल दिया, अरे भाई ये तो मैं खा रहा हूँ, ये तो शुगर फ्री है, इसमें मेरा शुगर स्पाइक नहीं होना, पर जरूर पोर्शन कंट्रोल प्रॉब्लम है इसमें. जब आपको पता है कोई चीज स्टीविया से बना है, कोई चीज शुगर फ्री से बना है, तो आप छोटे बाउल के जगह पे बड़ा बाउल ले लेंगे, एंड दैट इज नॉट गुड फॉर योर हेल्थ. Okay, so you can eat everything in your diet. You can eat rice also. It has seen that rice is not seen a good one for diabetes. But again, what I say is a portion control. A portion control will help you because a diabetic person needs healthy fats to digest everything inside. So healthy fats हमको हमारे घी से मिलेगा, हमको हमारे चावल से मिलेगा, हमको हमारे दाल से मिलेगा, proper रोटी सब्जी से मिलेगा. So a diabetic person should see that every meal has a regular carbohydrate, fiber, proteins, fats, all is balanced in their diet, and it is complete continued diet. ऐसा नहीं कि आज मैंने फैट ज्यादा खा लिया, कल मैंने कार्बोहाइड्रेट ज्यादा खा लिया, परसों मैंने कैलोरीज ज्यादा बढ़ा दिया, परसों मैंने कुछ और ज्यादा खा लिया. इससे होता क्या है कि आपका इंसुलिन पावर कंट्रोल करने में प्रॉब्लम होता है. So to maintain, you have to maintain your diet as per. Okay, so you have to include chana, जो बहुत अच्छा snack है in between, so that will help you. And again, जब कभी हम बोलते हैं मीठा बना है, तो ये मैंने जरूर देखा है मेरे पेशेंट्स में, मेरे क्लाइंट्स में, कि वो बोलते हैं कि नहीं मैम मैं तो कुछ नहीं, शुगर फ्री चाय लेती हूँ, उसके साथ में 2 मारी बिस्किट खा लेती हूँ. मारी बिस्किट आर गुड फॉर डायबिटिक वन. नो, मारी बिस्किट्स आर नॉट गुड फॉर डायबिटिक वन, बिकॉज आप खा रहे हो 2 शुगर, उससे अच्छा एक छोटा सा पोर्शन मिठाई का खा लिया तो चल जाएगा, क्योंकि उसमें मैदा आता है, दैट इज अ प्रोसेस्ड वन एंड इट हैज अ प्रोसेस्ड शुगर इन इट. सो डोंट कीप द माइंडसेट दैट बिस्किट्स आर गुड फॉर द मिडिल स्नैक. नहीं, उससे अच्छा यू कैन हैव अ होममेड स्नैक ऑफ मखाना with very little oil in it, or a dry snacks, or you can have a fruit with it. Or again, for fruits I should clear that fruits are natural sweeteners, so इसमें भी portion control होना चाहिए. You can have 1 or 2 fruits, but at a little portion every day. ऐसा नहीं. And sitafal is not good, chiku is not good for diabetic person. Juices are not good. Any of the juices are not good because you're removing all the fibers out. So अगर फाइबर्स पूरे निकाल दिए, खाली वो जूस में शुगर बचता है जो आपके बॉडी में जाके और शुगर को स्पाइक करता है. तो आप ऑरेंज खाते हो, आप स्वीट लाइम खाते हो, आप पोमोग्रेनेट खाते हो, पर हैव अ पोर्शन ऑफ इट, डोंट हैव जूसेस ऑफ इट. ओके, सो टेक केयर ऑफ द फूड व्हाट यू आर हैविंग, हाउ मच शुगर इनटेक, हाउ मच कैलोरीज यू आर इनटेकिंग, and how much you are burning it up. Daily pranayama and meditation and yoga asanas are compulsory with 10 to 15 minutes of walk. Walk is recommended every day for every diabetic person. So that will also reduce the sugar levels completely, maintaining the asanas and the pranayama and meditation. And again, if you have any of the hobby, do include your hobby in your daily life. तो इससे क्या होता है, जब आप आपके हॉबी में रहते हो तो यू automatically reduce your stress level completely. And whenever you're doing any of your work, maybe you're doing it at your office level also. So don't make that attempt कि यार ये तो मेरा job है, ये मुझे करना पड़ रहा है. No, do it with a good mindset. That because of this job, you are completely occupied. You are happy at over here at the office place. You are happy that you're taking something good to your personal life also. You're happy that it is fruiting you to your personal and your professional life. So with a happy mode, if you do work at your office also, then that will definitely help you in the personal level also. Okay, that will maintain that energy level. So please take care of your diet and have your dinner as early as possible. Make it a lighter dinner if you're having it little late in the night, and take a proper meal which includes everything. Take a nap in between in the afternoon if possible. If you're in the office, just make an attempt to close your eyes and we'll just relax ourselves. Please do, everyone do with me. Index finger to the thumb, or you can take a Brahma mudra for that. Middle to finger, last two fingers to the thumb. This helps in improving the energy level and the immunity power of a body. So just keep this method, keep your eyes closed, and just relax yourself as you're not taking, as you're not getting time for a nap in between in the afternoon. You have to relax your system by doing this simple deep breathing. So inhale by the nose, complete exhale by the mouth. A long exhale out. Inhale. A complete exhale. Inhale. A long exhale. Relax. This helps completely in relaxing out completely. I think so. Okay, we can complete it. We have to go further towards the breathing pattern, towards the pranayama and meditation. Every diabetic person should do savasana every day, and it should be a complete savasana. Now today we will do it over here. And Kapalbhati Bhastrika is very important. Kapalbhati is very important for a diabetic person to improve blood circulation towards your system. Kapalbhati and Agnisa. But this again has restrictions for heart patients, for hernia patients. So before doing it, do take advice and then continue it. So Kapalbhati करना कैसे हम एक बार दिखा देते. Kapalbhati and Agnisar are the Shuddhi Kriyas for human body. Okay, so index finger to the thumb, roll your shoulders back, keep your spine straight, keep your eyes closed, concentrate on your stomach area. Inhale, stomach out. Exhale, stomach in. छोटा inhale, बड़ा exhale. कपालभाति कर रहे हैं. आंखें बंद. Inhale out. So while doing, again, you're concentrating on yourself. As I mentioned, mind-body coordination is very much necessary. So you have to concentrate on yourself, on your ab muscles, what you're using it, and do Kapalbhati at least 50, 100, and slowly increase it till 500 times. But that's not necessary that first day you have to sit and do it 500 times. And as I mentioned, all the medical conditions will have a modification in this. Okay. Now we'll go towards Agnisar. Agnisar helps in reducing the fat cells in our abdominal area, to move out the fats from our system completely and to massage all the abdominal organs. करना कैसे मैं एक बार बता देती हूँ, फिर हम one time साथ में करेंगे. Inhale करेंगे हम chin up, exhale करेंगे chin lock. अब वापस breathe in नहीं करना है, stomach को अंदर बाहर movements करेंगे 5 times. So I have moved my stomach like waves in and out without inhaling again. When I finish for 5 times, again I will inhale. Do everyone inhale. Exhale, chin lock, and move your stomach in and out 5 times. Release it, relax. Due to time restrictions, I can't show you much. So if you have any of the queries, please let me know. Okay. So Kapalbhati we did, Agnisar we did, and after that we'll go towards Anulom Vilom. That is, and just show you the method today. Vishnu Mudra lena hai. This is called as the Vishnu Mudra. First two fingers inside your thumb and your ring finger. Close the right nostril. Inhale by the left. Very slowly. Exhale by the right. Inhale by the right. Exhale by the left. This is a complete Anulom Vilom. So this you have to continue it for at least a minute or whatever is comfortable for you. Never do anything which is not comfortable for your physical body and your physical mind. Okay. So just do whatever your body is saying yes, how much ever is comfortable to do it. Okay. So after Anulom Vilom, we have to go forward for our tranquilizer, that is Brahmari. Brahmari करने के लिए हम सारे साथ में करेंगे. 3 times Brahmari complete. Close your ears. Cover your eyes. Inhale.